Good morning and welcome to UroNurse News. Today's story looks at a growing debate in healthcare. Should patients receive their laboratory results before their healthcare provider has even reviewed them? For years, patients often waited for a phone call or office visit to learn their test results. Today, thanks to electronic health records and patient portals, many laboratory and pathology results are released automatically, sometimes within minutes of being finalized. That means patients may see their results before their physician, nurse practitioner, or physician's assistant has had an opportunity to review them. So is this a positive step towards transparency, or does it create unnecessary stress and confusion? Well, let's look at both sides. There are several important advantages to immediate patient access. First, it promotes transparency. Patients no longer have to wait days or even weeks to see information about their own health. For patients who understand medical terminology or closely manage chronic conditions, having immediate access can be empowering. It also makes it easier to share results with multiple healthcare providers. If one physician hasn't yet received records from another office, the patient can often access those results directly through their portal. Another benefit, patients have time to review their results and prepare thoughtful questions before their appointment. And when all the results are normal, immediate access can provide reassurance and reduce anxiety. Now, those are some meaningful advantages. But there are significant downsides as well. Many laboratory reports contain values that fall slightly outside of the reference range. Now, that doesn't necessarily mean something is wrong. In fact, many of these findings are clinically insignificant. Unfortunately, patients may not know that. Seeing a highlighted abnormal number without medical context can quickly lead to fear, confusion, and unnecessary worry. Some patients immediately begin searching online. Others send urgent portal messages or request emergency appointments. And even though the results may not require any treatment at all, this places additional pressure on already busy healthcare teams. Now, the emotional impact becomes even greater when the results truly are significant. Imagine receiving a positive biopsy, an unexpected cancer diagnosis, or a positive sexually transmitted infection test late on a Friday afternoon. If the physician isn't available until Monday morning, the patient may spend the entire weekend overwhelmed with anxiety and unanswered questions. This highlights one of the biggest challenges of immediate result release. Information without explanation can sometimes create more distress than reassurance. So, what can health organizations do? One idea is allowing patients to choose. Some patients may prefer immediate access, while others may feel more comfortable waiting until their healthcare provider has reviewed and explained their results. Giving patients the ability to opt in or opt out could provide a more personalized approach. Another solution is education. Patient portals could include a reminder that some abnormal values are expected and may not represent a serious medical problem. I wonder how AI might fit into this. They could also encourage patients to wait for their clinician's interpretation before drawing conclusions. Healthcare professionals also have an important role. When ordering laboratory tests, we can prepare patients ahead of time. Simple statements such as, "Some values may appear outside the normal range," or "That doesn't always mean something is wrong," or "If there's anything urgent, we'll contact you immediately." Those conversations can reduce anxiety before the results even arrive. Now, many clinicians also send quick portal messages after reviewing results. Even a brief note saying, "I reviewed your labs and everything looks reassuring," can prevent unnecessary worry and reduce follow-up phone calls. Ultimately, early access to laboratory results is probably here to stay. Like many healthcare innovations, it's a double-edged sword. It improves transparency, encourages patient engagement, and gives patients greater control over their health care. But it also reminds us that laboratory numbers alone don't tell the whole story. Clinical judgment, patient history, symptoms, and professional interpretation remain essential. The challenge moving forward is finding the right balance between immediate access and meaningful medical guidance. So what do you think? Put it in the comments. Should patients automatically receive lab results before their healthcare provider reviews them? Or should patients have the options to choose? Let me know your thoughts in the comments below. If you enjoyed today's UroNurse news, please like, subscribe, and click the notification bell and do whatever else you want to do, because you don't want to ever miss another episode like this. Coming Saturday to UroPatient. Did you see your potassium citrate pill in the toilet? Don't panic! You may have seen exactly what you're supposed to see. Many patients are surprised when they notice what looks like an undissolved pill in their stool after taking potassium citrate. It can be alarming, but in many cases is completely normal. If you ever wondered whether your medication is working, this episode is for you. So tune in this Saturday at UroPatient.com, 10:30 a.m. Tomorrow on UroNurse News, can a robotic water jet outperform one of the most established laser procedures for treating enlarged prostates? Join me as I break down this exciting Water 3 clinical trial comparing aquablation therapy with HOLEP, holmium laser enucleation of the prostate, for men with lower urinary tract symptoms caused by an enlarged prostate. Tune in tomorrow to find out more.
I'm Vic Senese for UroNurse News. Don't forget to like and subscribe. The experts' opinions in this communication are personal and not representative of any organization. They are for informational purposes only, not official guidance. Viewers are advised to use their judgment